Danny. I'm going to be your nurse today. We're going to be doing a little assessment. Is that okay?
That's fine.
Okay, I'm going to start by assessing your orientation. Can you tell me what year it is?
It is the year 2020.
Okay, and where are you right now?
We're at the hospital right now.
Okay, and what's your name?
My name is Danny Hoover.
Okay. So she's alert and oriented times 3. Next, I'm going to go ahead and just do a little hearing test. Let me know if you can hear this.
Yes.
Okay, can you hear this?
Yes.
Okay, I'm going to go ahead and assess your fine motor skills. I'm going to put my finger out. Touch your nose, my finger, and back to your nose, okay? Okay, very good. I assessed your gross motor skills as you walked in the room. Next, I'm going to go ahead and assess your pupils. Go ahead and just look off at the clock in the distance for me. Okay, your pupils are a size 5. I'm going to shine a light into your eyes. Okay. Okay, your pupils are round, equal, reactive to light, and accommodate, which is all very good. Can you go ahead and swallow for me? Okay. Your ability to swallow is good, as well as your ability to follow commands, and your speech is normal. It's not slurred or impaired in any ways. Can you close your eyes for me? I'm going to just test your sensory. I'm going to do this by just touching your arms, and you tell me which arm I'm touching.
Both.
Okay.
Left. The right.
Okay, very good. Okay, now I'm going to go ahead and assess your cardiovascular system. I'm just going to do this. I'm going to start by listening to your heart for 1 minute. Okay. It's about 80 beats per minute, which is within normal range. I also didn't hear any abnormal sounds, and the S1 sounds and S2 sounds are present, which is good. Next, I'm going to go ahead and just assess your pulses. So can you lay down for me with your head up here? I'm going to start with your temporal and work my way down to your feet. Okay. Then your carotids. Doing one at a time to make sure I don't cut off any circulation. Brachial. Radial. Okay, can you flex at the knee? Popliteal. Popliteal. Okay, put your leg down. Dorsalis pedis. Posterior tibial. Okay. I would rate your pulses a 2 on the 0 to 4 scale, which means that they're very normal. And they're equal throughout your body bilaterally. Can you look, roll up your pant legs at all? I'm just gonna assess you for edema. Okay. She has no edema. If she did have edema, I would assess if it was pitting or non-pitting, and if it was pitting, I would rate it on a 1 to 4 scale. Okay, we're gonna go ahead and move on to your respiratory system.
Okay.
Okay, I'm just gonna go ahead and start by counting your respirations. If we were doing this in a clinical setting, I wouldn't let my patient know that I was counting their respirations. I'm gonna count them for a minute. You had 11 breaths per minute, which is pretty normal. The average is about 12 to 20 per minute. While I was watching your breathing, I was also assessing for quality of expansion. Your chest rises and falls at the same time. Your breathing is unlabored, as well as your breathing not being too deep or too shallow. It's pretty normal.
That's good.
Yeah. Can I have you sit up for me? I'm going to listen to your lung sounds now.
My stomach was growling there for a second.
Go ahead and just take a deep breath every time I say now. Okay, now. 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 Okay, your lung sounds are equal bilaterally. I didn't hear any abnormal sounds of your lungs, no mucus or anything like that. Do you have a cough?
I have a smoker's cough sometimes.
Is it productive or unproductive? Do you ever cough anything up?
No.
Okay. If it was productive, I would ask her to describe the sputum. I would ask her to describe the consistency and the color, and if I could see it, it would be even better because I could just describe it myself. I would also document that she's on room air. Okay, next we're going to move to your gastrointestinal system. Can you lay back down for me? And is it okay if I look at your stomach?
Yes.
Okay.
She's been growling a lot lately or making some digestive noises, so
That's
I
good.
apologize.
No, that's good. That's what we want. Okay, first I'm just going to go ahead and observe for any distension or masses of any kind, and I don't see any, which is good. I'm going to start next by listening for bowel sounds in all 4 quadrants. I'd listen
Just
for a
breathe
minute.
normal. Should I just breathe normally?
Mhm.
Okay.
Okay. Everything sounds normal. I can hear bowel sounds in all 4 quadrants. The average amount of bowel sounds is about 5 to 35 per minute. Next, I'm going to go ahead and just palpate and let me know if you have any pain or uncomfort anywhere. I'm going to do this in all 4 quadrants as well. Also noticing that her stomach's soft and I don't feel any masses anywhere.
I didn't have pain.
Okay, which is good. You can put your stomach away now. I'm just going to ask you a few questions.
Okay.
I also observed that she didn't have an ostomy present. When was the last time you had a bowel movement?
Yesterday, actually.
Okay, is that pretty normal for you?
Sometimes I skip a day, but normally I go in the mornings. I have a morning routine.
Okay. Any nausea or vomiting lately?
No.
Okay. And are you on any special kind of diets?
No.
Any pain with urination?
No.
Any signs of incontinence? Do you ever pee yourself?
No.
Okay. In the clinical setting, I wouldn't ask the patient that. I would simply just observe for myself. And do you have any drainage devices like a Foley catheter, anything like that?
No.
Okay. Okay, so next we're going to go ahead and move on to your musculoskeletal system.
Okay.
Can I just have you stand up and walk across the room for me? I'm just going to assess your gait. Just walk about halfway across the room and walk back. Okay, you have a nice steady gait, no shuffling, nothing like that. Next we're just going to do some range of motion. I'm going to start by assessing your cervical spine, so can you just roll your head around for me? Okay, can you turn around and touch your toes? So I can see your back, yep. I'm going to be assessing your thoracic spine and also checking for any asymmetry in the body, but everything looks pretty symmetrical, so that's good. No curvature of the spine or anything like that. The elbows, your wrists, fingers, knees, ankles, both ankles, and then your toes. Okay? Okay, and then I'll do your hips as well, so just up and out. And up and out. Okay, everything looks really good. Next I'm going to go ahead and assess your muscle strength. You can sit back down. Go ahead and just squeeze my fingers as hard as you can.
Oh my.
Okay, I would rate your muscle strength a 5, which is good.
Okay.
Go ahead and lay back down. And press on the gas. No, not quite.
Wait, what?
Just flex your feet downward as hard as you can so I can assess. Like you're pressing on a gas pedal, yeah. Okay, you have good muscle strength in your feet as well. So, do you have any pain anywhere?
I do. I have a little bit of pain in my left wrist.
Is it like a throbbing pain, a sharp pain? How would you describe it?
I would say a throbbing sometimes. It's not really sharp.
Okay, and when did this the pain start?
I actually fell.
You fell?
The other day, yeah. Like it wasn't a big fall, but I like caught myself with my hand.
Okay.
So
You just have a little bit of pain in your left
Yeah.
wrist. Okay. Can you rate that that pain on a scale from 0 to 10, 0 being no pain and 10 being pain so severe that you can't focus?
I mean, I would say a 4. It's like bothersome sometimes, but
Okay. I'm gonna just come back and keep checking on that every couple hours just to make sure the pain doesn't move to any other places in your body.
Okay.
Okay, which I'm sure that it won't since it's just due to
Yeah, I
falling,
think
but
it's
just
due.
to make sure everything's okay.
I appreciate that.
Now I'm gonna just go ahead and assess your integumentary system. Can you just open your mouth and stick your tongue out? And we'll assess your mucous membranes. Okay, everything is, okay, you're good. Everything is pink and moist, which is good. I don't see any cracking anywhere. Then I would go ahead and assess the temperature. She's very, she's warm, which is good. She's not moist, she's dry, which is good as well. Is it okay if I assess your skin to her? I'll just go ahead and like pinch a little piece of your skin.
That's fine.
Just checks for hydration. Okay. And she has good skin turgor. If I was assessing her skin integrity, I would do that while she was in the shower just because that's a little invasive to just do in an assessment. And her skin is flesh tone to her ethnicity. So that's good as well. So I'm just going to go ahead and do a little psychosocial assessment. Do you have a good support system?
Yes,
Who do you talk to when you're going through things?
my family.
Yeah, you have a pretty good family life.
Mm-hmm.
You get along well with everybody. That's always good.
I mean, you know, little families have little bickers, but pretty much
Yeah,
most
of course.
of the time.
I understand that. Whenever you're stressed, how do you cope with that?
I try to sometimes exercise or listen to some calming music, or if it's sometimes a really stressful situation, I have to do the breathing technique.
That's good that you have good coping techniques.
I'm still learning, but
Yeah, of course. Do you have any cultural or religious needs that you think I should know about to be able to better take care of you?
no, just good manners.
Okay, of course. And do you currently work?
I do.
And where do you work at?
I work in a nursing home.
Do you enjoy that?
I do.
Okay, yeah. I used to work in a nursing home too. I really enjoyed it as well. So I would, she's in a good mood. She's very pleasant. I would say that she's in the self-actualization part of Maslow's because all of her physiological needs are taken care of. Her safety needs, she has shelter. She seems to have good self-esteem, so that would put her in the self-actualization. Also, the last thing that I have to say is, I'm not sure if I said this already, but if I were to assess the femoral, I didn't do it in this assessment because it is a little bit invasive, but the femoral pulse would be found right in here. Okay, I think that's all, kid.